Good afternoon, or I guess almost good afternoon. Today I will give an update on COVID-19, including some questions and clarifications around the testing for individuals aged 20 to 29 who live in the Greater Charlottetown area, and the COVID-19 vaccine and the requirements for self-isolation, and also like to clarify some issues related to the circuit breaker measures. And so I have good news today. I am pleased to report that there are no cases of COVID-19 in P.E.I. We have 13 active cases that are all self-isolating at home. The current COVID-19 outbreak in the Charlottetown area is made up of 11 cases. All of these individuals are linked and are close contacts of another case. So this means they could be work colleagues, roommates, or family. None of these cases have a history of recent out-of-province travel. Contact tracing and the public health investigation continues. We have not yet identified the source of the outbreak, but public health is leaving no stone unturned in terms of trying to identify a source or index case for this outbreak. Despite our best efforts, it is possible that we may not be able to identify the source of this outbreak, but we will continue to make sure that we identify the close contacts and test them as required. Our 13 active cases have at least 200 close contacts. These close contacts have been tested and will continue to remain in self-isolation for 14 days, regardless of their test results. And these close contacts are being followed daily. Since the pandemic began, we've had a total of 84 cases of COVID-19, and fortunately, to date, we've not had any hospitalizations or deaths related to COVID-19. As announced on Sunday, we have recommended that individuals in that age category of 20 to 29 living in the Greater Charlottetown area be tested for COVID-19, even without symptoms. And the response from that 20 to 29-year-old age category since Sunday has been tremendous. I'd like to thank this age group for responding so positively to our advice. Given the high levels of response from individuals in the 20 to 29 age group living in the Greater Charlottetown area in responding to our ask to get tested, we are asking now for this age group to help us manage the demand and waits in our testing clinics for the next few days to ensure that those who are experiencing symptoms and those who are at greatest risk get tested first. So our focus for the next few days is for individuals 20 to 29 years old and living in the Greater Charlottetown area. We want the following people in particular to go to get tested. If you live with multiple roommates who are in the same age group, or if you work in a crowded environment with people of the same age group, such as perhaps the fast food industry, or if you are experiencing any symptoms of COVID-19, these are priorities. People who are experiencing symptoms should go to a testing clinic on their own and do not travel with other people. The reason that we have focused on this 20 to 29-year-old age group is certainly based on our epidemiology across the country, but also in the cases of this recent outbreak. We know that COVID can be transmitted easily among people in their 20s and 30s, and some individuals do not always have symptoms, and yet they can spread it to others. And we know that COVID-19 easily spreads among people who are in close contact for a sustained period in a closed space. And so that's why we've identified these particular groups as priority this week. Yesterday, there were approximately 2,000 individuals tested across P.E.I. A large number of those are in that 20 to 29-year-old age category. Half of those tests have approximately half of them have been completed, and another half are pending. So thank you to everyone who went to be tested and to the others who are planning to be tested this week. Thank you for caring about your health and the health of others, and the commitment and leadership that you have demonstrated is wonderful. Please remember that a negative test result today does not mean that you will be negative tomorrow or the next day. If you receive a negative result, you can be sure you did not have COVID-19 at that point in time, but if symptoms develop after your negative result, you should arrange to be retested and then isolate until your result comes back if you're symptomatic. And I know Marion will be sharing more information about the availability of the testing clinics in a few minutes. A special thank you to our partners at Island EMS and Health P.E.I., including the testing clinic and the laboratory staff, those involved in traffic control, and others for their prompt response to mobilize resources to increase access to COVID-19 testing across P.E.I. This takes a great deal of effort, commitment, and creativity on behalf of many of our partners, and thank you to everyone who had a role in making this happen. P.E.I. will be administering the initial shipments of vaccine to islanders based on the recommendation of the National Advisory Committee on Immunization. And in no particular order, the priority groups that have been identified are residents and staff in congregate living settings that provide care for seniors, such as long-term care and community care, adults 70 years of age and older, beginning with adults 80 years of age and older, healthcare workers, including those who work in healthcare settings and personal support workers, and adults in indigenous communities where infection can have disproportionate consequences. And provided that Health Canada gives regulatory approval, Prince Edward Island is expecting to receive an initial shipment of the Pfizer vaccine next week. This first shipment will contain 1,950 doses of vaccine, allowing us to vaccinate almost 1,000 people initially. And the shipments are anticipated then to continue. Again, subject to regulatory approval, P.E.I. will begin receiving the Moderna vaccine a couple of weeks later, anticipated after the Pfizer product. And this is the product that can be moved around more easily. But because of the storage products of this first vaccine, the Pfizer product, it must be administered at the location where the vaccine is delivered. In other words, the vaccine cannot be moved from the location where it is dropped off. Our system is ready to receive, administer, record, and report on vaccine as soon as it arrives in the province. The protocols and reporting requirements for this vaccine are stringent. P.E.I. is prepared to meet all the required standards for the handling and administering of this vaccine. We are receiving support from representatives of the Canadian Armed Forces who have expertise in logistics and planning. I know it will take months for all islanders to be immunized against COVID-19, but all islanders who want to be vaccinated will be able to receive it. The day that vaccine arrives here in P.E.I. will be an exciting day for our province. And although the first shipment is a small supply, we know that more will be coming. And we know that if we get people vaccinated that are the most vulnerable, it will benefit all of us. Although I mention self-isolation at every briefing, I want to take a few minutes to remind everyone how important self-isolation is to our COVID-19 response. Self-isolation is a legal requirement in P.E.I. If public health staff are not getting complete information or incorrect information from cases or close contacts, individuals can be charged with obstruction of a public health official. We will continue to charge people who do not comply with the legal requirement to self-isolate. Self-isolation can prevent the spread of COVID-19. It is the foundation of our ability to contain the transmission of COVID-19. I am aware that there are people in P.E.I. who do not want to follow the self-isolation rules and have chosen to put themselves and others at risk. When advised to self-isolate, you are required to stay at home and limit contact with others. People returning to P.E.I. from out of province travel, people diagnosed with COVID-19 and their close contacts, and symptomatic individuals awaiting test results are among those who are legally required to self-isolate in P.E.I. When in self-isolation, you need to stay on your property and not leave unless you need to seek emergency medical care. You need to have someone drop off groceries and other essential supplies at your door. If you are living with others during self-isolation, you must stay in a separate room and ideally use a separate bathroom. If you must share a washroom, it should be disinfected after each use, especially the high-touch surfaces, taps, doorknobs, light switches. When self-isolating in a home with other people, you have to stay apart. You do not have meals together and you do not interact. If public health staff are not getting complete information or incorrect information, I'm going to repeat it from before, we will charge people with obstruction of a public health official and continue to charge people if they are not self-isolating. The 2-week circuit breaker measures that came into effect yesterday are important in helping to break the chain of transmission of COVID-19 and P.E.I. We have learned from other jurisdictions that incremental or partial measures do not have the same impact in containing this virus as stronger measures. To deal with the sharp rise in cases of COVID-19 that we have seen over the weekend, as a province, we implemented strict, time-limited measures for a short period of time. I'd like to provide some additional clarification on a few points regarding the circuit breaker measures. People may participate in outdoor, non-contact recreational activities with no more than 2 people from other households at a time. Careful attention must be paid to physical distancing from anyone outside your household. This would mean going for a walk or a run or a bicycle ride with someone outside your household. If a business or organization does not fall under the circuit breaker restrictions on the website, the business can operate using the applicable public health precautions. And organized gatherings are limited to 10 people and multiple gatherings are not permitted. So in particular, these organized gatherings would be weddings, funerals, and faith services. Enforcement efforts will focus on personal and organized gatherings, as well as organizations and businesses. Complaints will be followed up by law enforcement and public health officials. Warnings will be followed by fines, and in the case of a large gathering, all people in attendance, and not just the hosts or organizers, will be fined. It is easier for everyone if all Islanders work together for this hopefully short period of time and simply follow some of these circuit breaker rules. I know these measures are challenging and disruptive to all Islanders. And events that were planned have had to be modified or canceled, and many plans around the holidays for families are now up in the air. As I've said before, these measures are in place just for now and not forever. If we double down our efforts now, we hope our recovery period is shorter. It is our hope that we will see a positive impact of these measures within the next 2 weeks, and we can get this current outbreak under control. And our aim is to get back to the new normal phase as quickly as possible. The past few days have been challenging for all Islanders, and I know for Marion and myself included. Instituting circuit breaker measures is not a step that any of us wanted to take. However, it was necessary given the nature of the COVID-19 outbreak that was announced on the weekend. The prospect of having access to a vaccine for COVID-19 soon signals hope. There may be an end in sight. But we cannot let our guard down against COVID-19. We know that this nasty virus can penetrate any community, but we know what we have to do. We know we have to stand together by staying apart. We know our individual actions matter. We know the basic public health measures that are effective in fighting against COVID-19. Wearing a mask in public places, washing your hands often, maintaining that physical distance at least 6 feet from other people outside your household, keeping our contacts small and staying home when you're not feeling well, and getting tested if you have symptoms of COVID-19. I encourage everyone with smartphones to download the free National COVID Alert app. And thank you, Islanders, for your ongoing understanding and support throughout our COVID-19 response. Individuals and communities have demonstrated your good nature and tremendous resilience, patience, and kindness on every step of this COVID-19 journey. As we stand together by staying apart and double down our efforts to limit the impact of COVID-19, let us continue to be patient and kind. Thank you.
Good afternoon, everyone. We continue to test large numbers of people today, and large volumes of people are expected throughout the week at our testing sites. We appreciate there are long waits for some receiving tests today, as a large segment of the population is being asked to be tested. Please be patient. Our staff at the testing clinics and labs are working as hard as possible to expand our testing capacity. The Charlottetown Park Street Clinic is open today from 8 a.m. to 8 p.m. and will be open all week for those hours from Monday to Friday. The Summerside Slemon Park Clinic is open from 8 a.m. to 8 p.m. as well from Monday to Friday. Our O'Leary Clinic at the O'Leary Health Center will be open from 8 a.m. to 4 p.m. Monday to Friday this week, as well as the Montague Testing Clinic at the Montague Legion will be open from 8 a.m. to 4 p.m. Monday to Friday. Today, we also have our Stratford Town Hall pop-up testing site open from 8 a.m. to 8 p.m., and we will be considering the need to use that site as we move forward. Tomorrow, on Wednesday, we will have a clinic set up for students and staff at Holland College from 9 a.m. until 6 p.m. This site will be focused on that population of individuals aged 20 to 29, as Dr. Morrison mentioned, those living within the Charlottetown area, and if you're living with multiple roommates in that same age group, working in a crowded environment with people of that same age group, or if you're experiencing any symptoms of COVID-19. U.P.E.I. on Thursday will have a clinic for students and staff as well set up on their campus. And we'll have further details around the confirmed location of that clinic on campus as they are set with the university. I want to say thank you to Holland College and U.P.E.I. for their partnership with us and the willingness to assist in providing the space and communicating with their students and staff, making our testing and swabbing service even more accessible to this population. Please remember to bring your health card to the clinics or identification if you're a student that is not from P.E.I. The testing clinics do have processes in place for individuals who come without a vehicle and walk in, and individuals follow the direction of the staff on the site when they arrive. For those without transportation, as I mentioned yesterday, the best option is to request a test through our online booking, and clinic staff will contact them directly to arrange that test. I do want to remind employers that there is no requirement for staff in this 20 to 29 age group in Charlottetown area to refrain from working while awaiting a test. These individuals can attend work before getting a test and after receiving their test while awaiting results, as long as they are following the public health guidelines. Those without symptoms should consider getting a test in the coming days, as Dr. Morrison mentioned, to help us spread out the demand for testing at our sites. Sending them for an immediate test prior to coming to work is not necessary and is contributing to our backlog. That being said, though, anyone who does have symptoms should attend a clinic for testing as soon as possible and should not work until they get a negative test result and their symptoms are no longer present. Our laboratory is working diligently to get results back to people as soon as possible. However, we know with the number of tests being processed is far more than we have seen before, and so people can expect to wait for up to that 72 hours for negative results, and potentially a little longer if we see the numbers continue. The Joint Response Team is closely monitoring the impact of testing and this testing surge on our ability to offer services within Health P.E.I. Some primary care services are impacted due to these staff being the main providers of service at our testing clinics. Physician offices remain open and available for both in-person and virtual care visits, but some routine appointments and education sessions for chronic disease management, as well as non-urgent procedures in some of our primary care clinics, are being rescheduled during this 2-week circuit breaker period. Some of those services affected may include routine venipunctures, drivers' medical exams, ear syringing, and those types of items. These are temporary measures for this 2-week period to ensure staff are available to support our COVID testing clinics. A reminder about our visiting protocol changes, and that until December 21st, no visiting is allowed at Health P.E.I. hospitals, long-term care, or any other facility. Exceptions will be made for compassionate circumstances when the patients or residents are nearing the end of life. Patients and residents may have a designated partner in care attend with them, and as I mentioned yesterday, that partner in care is really part of our care team, assisting with providing care and socialization for our patients or residents, and are designated for that patient or resident. Our pediatric or newborn patients are able to have more than one parent or guardian with them if receiving care, either as an inpatient or in an outpatient service. In closing, I do want to reiterate Dr. Morrison's comments of thanking Islanders for their response to the request for testing. As we mentioned before during these briefings, it is our collective efforts that are contributing to our success, and I appreciate the patience of everyone and as well the professionalism and cooperation of all the staff and our partners in making this testing available to all Islanders who need it. Thank you.
Thank you, Marion. I will open it up for questions.
Julien Lecachel, Radio-Canada.
Bonjour, Dr. Morrison. Aujourd'hui, je voudrais parler des vaccins avec vous. Est-ce que concrètement, vous pouvez en dire plus en français? Combien de doses, à partir de quand les premières personnes vont être vaccinées? Qui vont être vaccinées et où vont-elles être vaccinées, s'il vous plaît?
Bonjour, Julien. Alors, comme en anglais, on vient d'annoncer vraiment qu'on va suivre la guidance du comité national à propos des vaccins. Et puis, ils sont des catégories qui sont les personnes qui travaillent en première ligne avec les personnes qui travaillent en healthcare, les adultes qui sont au moins 70 ans et plus âgés que ça. Et puis, on va commencer vraiment avec les adultes qui sont 80 et au moins 80 ans et plus âgés que ça. Et puis, on va descendre par 5 ans à la fois. Et puis aussi les personnes qui habitent à long-term care, community care. Et aussi les adultes pour les indigenous communities. Et je m'excuse que c'est pas tout traduit en français, Julien. Et puis, on ne peut pas faire tous ces groupes en même temps. On va avoir 1950 doses qui arrivent avec le Pfizer product la semaine prochaine, ici à l'île du Prince-Édouard. On a choisi une des locations pour les premiers vaccins. Et ça veut dire à peu près 1000 personnes peut avoir le vaccin commençant la semaine prochaine. Et puis après ça, on pense qu'on va avoir des vaccins assez régulièrement ici. Mais le premier produit qui arrive, il doit être donné où ça arrive. Alors, il faut aller à un hôpital. Alors, c'est de là qu'on va faire des personnes qui travaillent, les frontline healthcare workers. Et puis, mais aussi, on va avoir un autre vaccin qui s'appelle Moderna qui va arriver. Et puis, on va tout de suite aller pour les résidences et les personnes qui travaillent à long-term care. Et alors, ici à l'île du Prince-Édouard, les deux premiers groupes qui vont avoir les vaccins vraiment sont les personnes, les résidences de long-term care et puis aussi les personnes, les frontline healthcare providers. Ces deux groupes, et puis on va continuer à avoir plus de vaccins de les autres groupes qui sont identifiés comme priorité ici à l'île.
Donc, docteur Morrison, vous avez parlé de ces groupes-là. Donc, un vaccin pour la population générale, prenons un exemple, les 20-29 ans, eux, ces personnes ne seront pas vaccinées avant plusieurs mois. Est-ce que vous estimez que ces personnes-là vont être peut-être vaccinées en février, en mars, au printemps?
Alors, quand on regarde le nombre de vaccins qu'on anticipe d'avoir ici à l'île du Prince-Édouard, j'espère que par l'été, dans les deux premières quarts de 2021, on va avoir la chance de diminuer, d'avoir le vaccin dans tous ces groupes et aussi les groupes qui sont les travailleurs essentiels, les autres personnes qui travaillent en santé, les autres personnes qui travaillent comme policiers, qui travaillent les corrections, toutes sortes de groupes comme ça, les personnes qui sont identifiées comme plus vulnérables à COVID ou à transmettre COVID ou à COVID. Alors, j'espère que tout ça va arriver avant l'été. Et si on fait les vaccins pour les personnes, pour certains groupes, ça donne un bénéfice à tout le monde. Alors, on va avoir beaucoup de personnes entre 20 et 29 ans qui sont dans les autres groupes et qui travaillent comme les travailleurs essentiels, mais ça va augmenter pendant les mois qui suivent. Mais c'est la priorité est d'avoir les autres groupes de personnes qui travaillent ou sont dans les résidences pour les plus âgés.
Merci beaucoup.
Okay.
Heidi, CTV.
Hello, this is a question for Dr. Morrison. Dr. Morrison, what's your sense as to why P.E.I. is getting 1,950 doses? Do you know why the federal government, I guess, came up with that number? It just seems like the dose number is the same for every Atlantic province.
So it has to do a couple of things. There's only a certain amount of vaccine coming in this first shipment with the Pfizer product, and they come in trays of vaccine. So it's very difficult to split the trays. So we will be actually getting 2 trays of vaccine, similar to Nova Scotia, New Brunswick, Newfoundland. But it would be very awkward to try to only give us a portion of a tray. And so that is, I believe, part of the reason that we all have the similar amount.
And a follow-up, what is the capacity of vaccine that P.E.I. can handle in terms of refrigeration and delivery?
So we are very fortunate in this province that we have a sort of central point of most of our vaccinations do come into a provincial pharmacy and then go out to various immunizers, whether it's public health nursing, physicians, long-term care, pharmacy, and but our provincial pharmacy has normally or is really set up to deal with vaccines that are stored at 2 to 8 degrees. And the interesting thing about these first, and the complicating thing about these first 2 vaccines that are coming in are that they are frozen vaccines. And the Pfizer product has to be shipped as a frozen vaccine, and so that's why the freezer and where it's delivered is a little bit different on that first vaccine. We do have the capacity. We have the freezers ready. We have the supplies, And we have to remember, too, we just have administered close to 80,000 doses of influenza vaccine in the last 2 or 3 months, and we do that every year. So we know we can get vaccine into people and do so as soon as it comes and look forward to doing that.
Gabrielle, Radio Canada. Brittany Spencer, CBC.
Hi there. My question today is for Dr. Morrison and has to do with the vaccine. So you identified the priority groups that would get the vaccine first, but I'm wondering how you decide who within those groups, I guess, will get it first. And I'm wondering if you can tell me a little bit more about how it will be distributed, considering the vaccine can't be moved from the drop-off location.
Yeah, so great questions, and so I may answer both parts of both questions at the same time. And remember that it's the Pfizer product that can't be moved at this time. Now, it is anticipated at some point we may be able to move that product around a little bit more easily, but initially we have to give it at the point of arrival. And then the other product can be moved out more easily. So we look at our small numbers. So there is a COVID-19 immunization committee, as well as a working group that will help in this in some of the prioritization. We'll be, for instance, working with Health P.E.I. To identify which healthcare workers, for instance, if you only have so many you can do, which frontline healthcare workers would need to go 1 week versus the next week, and I think we know that everyone will get done, but for instance, people who are healthcare workers who are doing testing, really important to be done. There's emergency staff, there's a variety of healthcare workers, but Health P.E.I. will be involved in helping us look at who needs to be done within those healthcare workers, but we also need to work together because we have to adjust based on the vaccine numbers that we have coming in. And long-term care, we hope we will have certainly vaccine for private and public long-term care and community care to go out to residents and staff, and we'll be getting that out as quickly as we can. We have a meeting this week with private and public long-term care to review some of those details and work with them with that anticipated Moderna product arriving as very quickly in the short weeks ahead.
Thank you. And a follow-up question. You mentioned that if approved, the vaccine could arrive on P.E.I. as early as next week. So I'm wondering how long after it arrives on P.E.I. will it be ready to be distributed to people, and will vaccination start happening?
Well, of course, as we sort of referenced here, it will be by appointment and scheduled appointment for the, for instance, the healthcare workers that are identified, and they could start as early as being vaccinated on the 15th if it was to arrive on the 14th, the 15th, or 16th.
Okay, thank you very much.
Louise Martin, CBC.
Hi there to you both. Thanks for taking our questions today. Dr. Morrison, can you clarify the new guidance on who in that 20 to 29 age group should be going to get tested now? You mentioned a few groups, but I just want to be really clear on that. And if you don't fall into those categories, when should you be tested?
Okay, thank you, Louise, because I think it is definitely important to clarify. So for the next few days, in particular, if we can really focus on 20 to 29-year-olds who live with multiple roommates who are in the same age group, and if they're in that 20 to 29-year-old age category and work in a crowded environment with multiple other people in that same age group, such as we mentioned fast food industry, or of course at any time if you're experiencing any symptoms of COVID-19, not to ignore them, those symptoms. And those of course is in the greater Charlottetown area, which we have identified previously. And those who are not falling into one of these categories and do not have symptoms, then maybe you could just wait a few days and before you need to come in to be tested, or before you choose to come in to be tested.
I'm assuming this is partially in response to what we saw over the last 24 hours, and that was very, very long waits, up to 7 hours in some cases, and we heard from a lot of people who didn't have access to bathrooms or food. You have said you can make an appointment to be tested online or by calling 811. What is the turnaround time to hear back about confirmation of an appointment? Do you still recommend people maybe go that route instead of waiting in their vehicles?
I'll let Marion answer that part of the question.
Yes, as far as I know, Louise, the turnaround time is within the same day. Of course, if people booked last night, they would be contacted today if they were online late last night. So they would be receiving their calls today to schedule an appointment, and we work with people depending on their transportation needs or other challenges where they're living. And that is another reason why we've expanded our testing capacity and hours in our rural testing sites as well, to add capacity for those ability to book tests and appointments. So we are still recommending that definitely for people who need to be tested. We want to have access for any individual who has any symptoms to ensure they're able to get in a timely way.
Can you just quickly address, Marion Dowling, what we saw yesterday with those long waits and the no access? You can't really get out of the line once you're in it, and that seemed to be a big problem.
Yes, well, I think we were anticipating certainly a large number of people coming, but it did take us some time to maneuver some of the sites and make them a little more streamlined in the flow and process as far as traffic control. But we appreciated all the support from both P.E.I and the Charlottetown City Police and others who assisted us with getting those traffic lines moving. I don't think we anticipated the length of wait for people. So those other services aren't something, because even when we've seen requests for testing to the public before, we have been able to move through those lines much more quickly, and our staff do a great job of trying to anticipate that and make it ready. So we don't have other types of services, which of course would complicate things as far as cleaning them in between individuals and trying to stream people in and out of our sites. So we really focused on making sure the priority groups are getting access, adding hours, adding locations, and again, tomorrow putting that right on campus for Holland College and the following day at UPEI to try and support access to those individuals. I think the other thing we saw yesterday was that employers, and I mentioned it in my notes today, employers did put requests out to their young people who are working to go and get tested before they needed to come to work, which was not a requirement from the public health advice, and that definitely added to the numbers of people coming yesterday. So we wanted to further clarify that today.
Much appreciated. Thank you both so much.
Thank you.
Rachel Collier, The Eastern Graphic.
Hi there. Yeah, so I guess some of the questions I have left over here. An anonymous do-it-yourself HIV screening test was approved by Health Canada in November, and I just heard from some people championing these tests that it might be especially useful now during the pandemic while, you know, healthcare is shuffling around and people might be a bit more hesitant to leave their home. I guess, Dr. Morrison, what's your stance on these tests? Are they useful for islanders? Are you concerned people might not access appropriate care with these anonymous tests?
Hi, Rachel. So we actually have had conversations about what we call these point of care tests, including the HIV point of care tests. And I think that is a conversation with the lab, who I think today probably is not the day to talk to them about other tests as well. But we have had the conversation with the lab, and I think it's trying to make sure that the point of care tests then get the point of care tests sometimes then have to be confirmed by the lab, and how you do that and communicate that. But I do think the point of care HIV tests will be one more tool that we will be able to use in this province. And Rachel, we can follow up after this briefing, because if you're interested, we can provide some numbers for our HIV cases in the province, and some further details on that. I don't have those numbers in front of me, but we can certainly do that if you're interested.
Yeah, I'm definitely interested. And I guess also maybe you would know, like, are these kind of at-home, do-it-yourself tests something that the province is looking at funding or distributing or playing a role in that, or is it simply going to be something people can buy online at their own
I think that we can do all that as part of a follow-up, Rachel, because you need to look at the sensitivity and specificity of each of these tests, and how people can access them, and what the public health role is in the follow-up of the HIV tests.
Okay, sure.
Okay.
Thanks.
Okay.
Laurent Savoie-Acadienne.
Bonjour, Dr Morrison. J'ai une question sur les vaccins. Vous avez dit les plus de 70 ans seront prioritaires. Vous allez commencer par les plus de 80 ans. Comment ça va marcher concrètement? Est-ce que les gens vont être appelés au téléphone? Est-ce que ça va être dans l'ordre, par exemple, alphabétique? Comment vous allez choisir ceux à qui vous proposez le vaccin?
Bonjour. Alors, comme vous avez mentionné, on a des groupes de priorité, et puis on espère avoir plus grand nombre de vaccins quand on commence avec les personnes qui sont plus âgées dans la communauté. Alors, on est en discussion vraiment avec comment on va contacter ou avoir la communication avec les groupes qui sont un peu plus âgés, plus de 80. Alors, c'est les discussions que la communauté est en train d'avoir. Alors, quand j'ai les détails, on va les communiquer. On a mentionné qu'on commence à avoir un web page sur l'Internet qui, quand ces détails sont disponibles, on va les annoncer là-bas aussi.
Merci. Et est-ce que une fois que les personnes seront vaccinées, est-ce qu'il y aura des public health orders différents pour les personnes qui seront vaccinées? Est-ce qu'elles seront obligées de rester à la maison aussi, ou est-ce qu'elles pourront se rassembler différemment? Comment vous allez adapter ça pendant les futurs mois qui viennent?
Question excellente. On est en train encore de discuter, pas seulement ici à l'île Prince-Édouard, mais partout au pays. On sait que c'est important, je sais, en parler avec les vaccins avant d'avoir un herd immunity. Et vraiment, il y a des mesures qu'on ne peut pas changer jusqu'à temps qu'on a à peu près peut-être 75% de la population qui ont le vaccin. Alors, c'est pour cette raison qu'on veut que la majorité des gens a la chance d'être vaccinés, parce que c'est important pour tout le monde si on a au moins 75% de la population qui reçoit le vaccin aussitôt que possible.
Merci beaucoup.
Okay. I might just translate that last question. It was a question about what we might do in terms of changing public health measures as people start to get the vaccine. And it's a really good question. It's what we're talking about both provincially as well as nationally, how that will work. But I think one thing we do know is that we will not have a herd immunity that will really protect those who can't be vaccinated and those who aren't vaccinated until we likely achieve 75% of the population immunized. And so that is something that we will be discussing more and looking at over the weeks and months ahead. But it will speak to how important it will be that we get as many people vaccinated as quickly as we can, especially in our vulnerable groups, but also to try to achieve an overall population vaccine uptake rate that will protect everybody in the months and years ahead.
Stu Napier, The Guardian.
Hi, good afternoon to you both. I'll just ask you a question that was asked, but I didn't hear a full answer to it. If, let's say, the Pfizer or the Moderna vaccines arrive tomorrow, how many doses of the Pfizer vaccine can be stored in P.E.I. and how many doses of the Moderna vaccine could be stored in P.E.I. right now at this moment?
We have one huge freezer and a backup freezer, so we would be able to store as much Pfizer vaccine as they could give us. And the freezers for the Moderna product have already arrived, and so we can, if they would give us more vaccine, we have definitely room for it. I don't have the numbers, but I know we have more storage than we have vaccine at the moment. So, and a reminder, I mentioned the 80,000 doses of influenza vaccine. We're used to getting 40,000 doses of influenza vaccine, so we are able to store fairly significant amounts of vaccine. And now we have the freezers that we will use to store the products that need to be frozen.
Okay, thank you for that. So I guess just more of a bigger question just about what's happened in the last, 48 hours. I mean, I don't know if this is a move that's been sort of taken by other provinces of focusing testing on one age group, but can we determine whether it worked or not? I mean, if we had 2,000 tests within the last day, no new cases. Are you concerned that some maybe more symptomatic individuals may have been missed? Do you feel that it's generally a good sign? Do you think it looks like it's worked?
I guess out of the approximately 2,000 tests that have been done, only 1,000 have been actually run in the lab, roughly. So we don't have all the results back. So I think it's probably too early, Stu, to say if our targeted approach has identified a lot of additional positives, because I think it's going to take a number of days to determine that. I think it really highlights to me why it's important to do anyone with symptoms. And sometimes that age group, I guess we all may not always identify symptoms or think that we'd like to ignore some of our symptoms, and it's really trying to make sure that this age group doesn't ignore symptoms. In the lab and in the testing clinic, they do make sure that those with symptoms, those tests are run before those who don't have symptoms, or if you're a close contact of a case, then you are identified differently at the testing clinic and also in the lab. So those are run as a priority. So I think you saw in Halifax, they did and have been doing over the last couple of weeks testing for those young people, again, in an age range who have been eating or out at bars in the greater Halifax area. So it's not that different in some ways, trying to look at what cases we're seeing here, and then seeing how we can make sure we identify anyone else in that similar age range.
Okay, so I guess jury is still out, I suppose I should conclude?
So, I mean, I think with 1 day of testing, I think we need to and want to do more over the next few days. What we're looking for, of course, is how many positives we may or may not get over that period of time. Of course, we don't want there to be a whole bunch of positive cases, because what that will mean in our community will be significant. But at the same time, we want to be able to identify quickly anyone who is positive, so that we can follow up.
Okay, thank you.
Great. Thank you. I think that's it for today. Thanks.